Hi, Dr. Bird here, and I want to discuss with you how to help your neck pain, your back pain, your headaches with your sleep posture. We are at least, hopefully you're sleeping 7 to 8 hours a night, ideally, but we're at least in bed 4 to 6 hours a night. Hopefully you're doing more, but about almost a third of our lives we spend in some kind of sleeping position. So if you have bad form with your structure and you're sleeping like this, you're sleeping like this, not going to work, okay? So this is not a topic about beds. Different story. I'm just saying with what you have, if you have a side-lying posture, and let's take a step back. Laying on your back's the best. Laying on your side's second best. Stomach sleeping, never good. Imagine if you sleep like this, if you stood like this for 2 hours straight. Tell me that's not going to screw you up, right? Not what you want to do. So if you are lying on your side, we'll go to the second best first. Pillow between the knees, okay, from knee to ankle ideally. Now this isn't as big a pillow as I would need, but you have that, so ideally your neck is supported properly. You're laying on your side, okay? If your shoulder's pulled over, that's not necessarily the best thing, so you might even need something right here so that your shoulder doesn't get pulled forward and you end up having shoulder problems here. But if this pillow is between the knee, that's going to keep you from twisting, because look at the twist. Even if I have a good support on my neck, but I have no support here, look at the big twist I get. I put a pillow, now I mimic a standing posture. So what you want to do is an ideal curve. If we take a look at this cervical curve, low back curve, head is pretty much over the top of the shoulders. If you can mimic a good posture where your head is lined up straight over the top of your shoulders and not pulled forward or into weird positions, that's what your goal is. That's going to be the least amount of stress on your joints and on your spine. Those are your patients. That's going to lessen the problems that you're coming to see us with and speed up your recovery. Those of you who aren't patients, this is going to keep you from having as many issues. So ideally, the curve on the pillow has some kind of cervical spot where the curve of the neck, the head lies in it. So, like I said, where the head is lying back. You don't want your head popped forward. You don't want your head, if you're laying on your side, cocked one way or the other. Stomach sleeping is never good again. We'll say that about 17 more times. So laying on your back, if you put a pillow underneath your knees and slightly elevate the knees, where you're laying with the knees slightly elevated instead of just completely flat, a lot of times that'll take pressure off the low back. So you can do that just by lying on your back. Again, assume as you're watching this that I have a good cervical pillow behind me. So, and I'm laying where my knees are slightly flexed versus just flattened out. That may or may not help. So if that helps, great. If it doesn't, okay, fine. You don't have to have the pillow underneath the knees, but if you're side lying, go here. If your stomach's sleeping, oof, not good. Hopefully that helps, and give it a try. Thanks.